So, got one there. Anyone else? We in order to make the organization better, we need your input. He needs one.
I put one out yesterday.
Oh, you
I
can
did
go
think of something on there though I'd like to put on. So,
Need another one? Okay.
I mean, I don't know how taboo it is to. I just want to discuss more pricing wise on stuff.
Put them on there.
Okay.
Yeah, you know, those are.
I know that changes from region to
We
region.
may not be able to publish it. We can't-
Right.
We have a hard time getting away with price fixing.
No, yeah, like I said,
I'll just say go up.
if we start getting.
Yeah.
If wherever you are, go up.
Just go up. Yeah, no, just go.
So, actually somebody mentioned on the ORG website that they wanted to have a price range. And I'm like, well, maybe we can throw the bottom one out and the top one. But maybe we can-
Right, yeah.
But if you're 26, we want to say, please leave the industry or something like that. Too low, you gotta get out. So close your doors, do us all a favor. So. I wanna.
I'm early. This is 8:30.
Is it 8:30? Is it? I asked
I don't know.
everyone, I was like, it's 8. I just lost track of time.
You just start when you're comfortable.
I might as well leave now. It's a warm and fuzzy topic.
We'll get the price.
Yes.
From theirs that they've given, you know, doctor, box doctor, whatever. They're like, can you compete with this? You know,
Oh, yeah, no, it definitely says that.
Well, one account a year.
Nothing, let's go.
So, guys, and so I'll take a little time afterwards. I'd like to talk just a little bit. So give me about 5 minutes. And, I'll just, when you finish, you wrap up when you want.
We don't lose accounts to them.
Welcome. I hope you guys enjoyed yesterday. I hope that you reached out and met somebody new. If you and that you create new relationships. We love your input. So once again, for those, fill these out. We will take and we'll read every one of them and discuss them. And I want to thank everybody who took the time to come. And if I don't see you and thank you individually, I just want to thank everybody publicly. The organization is all about you and your input, and it's for all of us. So I look forward to seeing it develop throughout the years, and it will take all of us to make that happen. Thank you for being here. And with that, I'd like to introduce Tim Torbenson. He has actually been in the lab, so he's not coming with just an FDA regulation or regulatory speaker. He has grown up in the lab. Is that right?
45 years.
45 years. And he, one of the things I like, I will give a plug for him. One of the things I really like about Tim is he is not a fearful FDA or a regulatory person. He plays it straight, but he doesn't make you feel like you're going to fail. He believes in a positive way, and for that we're really happy to have him here because he'll let you know all the positive things that you're doing, and then tell you what you need to do in order to just get a little bit over the edge. Am I correct?
That's correct.
So, and with that endorsement, I'll turn the time over to Tim Torbenson.
Thank you very
And
much.
I'm going to go and chase a bunch of people down here.
Okay, should I talk slow at first?
Yes.
Am I too hot on the head? Okay. Well, good morning, and thank you for being here. I appreciate it. Lance covered a lot of my background. I've been in the dentistry 45 years. My father was a lab owner. I'm a second generation guy. I was a lab owner for a while. So I know what you experience on a day-to-day basis. I was more on the traditional restorative side, not necessarily in the ortho side. But when I got involved with the FDA, and I literally quit. I was an executive VP at a company called IDS, Integrated Dental Systems, and I was working with them running all the digital side. I was doing a number of 510Ks that I was submitting for them, traveling the world for them, and I quit. And I started this job this business in 2017. My interaction with the FDA, I got a very clear understanding of the direction that they were going with regard to added oversight to our profession. And that's the reason why I started this business, is to be able to be a liaison between the FDA and yourselves when you need that. And there's times that you just don't need it. It depends upon your laboratory and what activities you're doing. You don't need me. You probably need to be in communication with me to keep understanding what's going on with the FDA. But from that experience, and when I started this business, and the reason I started essentially was that the companies that are out there that perform my service, they were like $10,000, $30,000 to install a quality system in your laboratory. I thought that is rather grotesque. So I do a service by far much less. I'm 65 years old. I actually retired, kind of, but I run this business because I love it, all right? So what we're going to do today is I want to go through Dazed and Confused. And this is really where we are, and as dental laboratory owners, dazed as, first off, why is the FDA even in our lab? We've been operating for decades without having even a discussion of the FDA. Only when you picked up specific appliances did they come around, sleep appliances specifically, if we go back a ways. Now it's broadening that offer. So I want to address that tonight. But that's where, when I talk to a lot of lab owners, they're just, they're dazed. Why am I dealing with the FDA? On the confused side, and this is another reason why I do a lot of speaking, is there's so much misinformation out there. You can talk to a representative, you can talk to other consultants who are not dental consultants, but they're just general regulatory consultants. And I honestly, many of them just have it wrong. And they over-regulate. You have to do this if you're just doing that. There was one of the consultants that said, if you have a computer that has CAD in it in your laboratory, you need to register with the FDA. Registration with the FDA is for this year is $5,886. That's every year, all right? Just because you have a computer and you're doing designs or proposals. I don't like the word design because that means something different to the FDA. But anyway, so you're using a CAD system and you're printing models or regular standard appliances. The FDA does not belong in your laboratory. And I'm going to address all of that in detail almost per appliance. Not all of them, of course. And then at any time, this is meant to be a discussion. If you have a question, don't hesitate, raise your hand. I may ask some questions to see what we're doing here. So I have an opportunity to kind of focus in and be specific to your needs. And more important, here's what I'm trying to do. If I can learn how to use this thing. I'm going to try to keep it simple. And Einstein, he's much smarter than I am, but he got it right. If you can't explain it simply, you don't understand it well enough. And so I've been involved now with the FDA quite a bit. I engage the FDA on a weekly basis where I'm talking with them, we're exchanging emails. So I have a pretty good understanding of what's going on. And then one of the most difficulties that you exist and I have to deal with the FDA is when they send me a letter, it doesn't make any sense. It's just like, just speak English, all right? And I think we'll see some examples of that. But most importantly, and JFK said this, and quite appropriately, in time of turbulence and change, it is more true than ever that knowledge is power. So this is what I want to give you, because I want to give you a clear understanding of what you need to do and what the FDA is doing in our industry to your profession, so that you can feel very comfortable and that you can move your laboratory forward. A lot of laboratory owners I know don't take actions to incorporate more technology in their laboratory because they fear the FDA, when in reality, they just don't know what position they're in. So without that knowledge, they don't make the right move for their business. So that's what we want to discuss. Okay. So let's do just a quick run through of what is completely clear of the FDA oversight and what has FDA oversight. And the most important thing is, this is one of the most important documents within all of the FDA that impacts your laboratory, right? And I'm going to refer to this quite a bit. It's section 807.65, exemptions for device establishments. That's you. You're a device establishment. You're a medical device manufacturer. And according to this document, which was brought forward in the 1970s, gives you a complete exemption from having to register with the FDA at that time. Okay, so most dental laboratories and orthodontic laboratories are completely under this exemption until they fall out of it. I'll address that. And if you don't have to register, then you don't have to have a quality system. Without registering, without a quality system, there's nothing for the FDA to come and to your facility and inspect you. So this gives you a free and clear. And we're going to talk about what appliances in general, what this covers, and specifically to some of the information you got on some that was just misinformation. Okay, so let's look at two. On this side is your palatal expanders, which are really complex devices. I mean, they're active. You're moving things around in the patient's head. There's no FDA oversight. And if you're taking pictures, just at the end slide, there's my email. Send me an email saying, Tim, send me your deck, and I'll send you this entire presentation. Okay, just let me know. And the last slide, I have my email address. So then over here, we have sleep appliances. And of course, with those, they're class 2 devices. More importantly, they're 510K cleared, so they have FDA requirements. And we're going to dig into this in detail on each of the appliances. This one also, this is confusing. Here we have splints, we have mouth guards, we have all those regular appliances that you've been manufacturing. And there's been people saying that with mouth guards, you have to get a 510K clearance. Not true. Okay, and we're going to address that specifically as well. On this side, we have orthodontic aligners. They have regulatory requirements, all right? Next. One of the things I do, first off, I get emails from the FDA daily basis. And they're good because they explain in the FDA's language what we can do and what specific guidance on certain appliances. Now this one, and I want to kind of tear this one down a little bit more to prepare for another document we're going to address here soon. And you can see that the draft version of this document was issued on May 10th of 2016. All right. Prior to that, and that was in 2015, the FDA launched and released a discussion document. And that's when they started a conversation with us, anybody who wanted to have input for the FDA, about what the industry and what citizens wanted to give information to the FDA so to assist them with making this guidance. The FDA literally asks us, but we don't know it, do we? You didn't know that happens. So then they come up with a draft version, which they did a year later in 2016. That too went out to the public to give input and give their opinion on it, all right? And then the final guidance came out over a year and a half later in 2017. Okay, so that's the process, and there's a reason why I'm going through this. It seems boring, but it'll fire you up in a minute. This is a process that the FDA goes through to get an idea of what they want, or what they should do on their side to protect the patient. The FDA's main objective, right, and this is, if we think this way about what the FDA is doing, we can see areas where they're overstepping. So for example, the first item on their list as far as their mission statement is the patient safety. Okay, patient safety is what we're doing. Can it harm a patient in any way? Can it cause death? Right. So this is a really good understanding for our profession because we don't hurt people. We leave that up to the guy who has the license, the man and woman, the license and the practice, and that's what they do. We don't do that. No one's died from an orthodontic appliance. Right? And the FDA knows that. For that reason, and this is what Lance was referring to, for that reason, our quality systems are more focused on the quality of our products, not the danger of our products. The FDA just wants to make sure that we're doing a good job every day, which you do, otherwise you're not in business, right? Thank you. Okay, so this doesn't make any sense right now, but it was important. So this is actually one that came out and gave us an opportunity to see, gave us an opportunity to see where the FDA was going. From that, at this time, the only impact for our industry has been a recent release of this new product code, PZY. And we're going to talk a couple product codes here. And this is the dental division's release on additively manufactured denture teeth. Now, you may think, well, that's not a big deal. But if you ever need to attach one denture tooth to an appliance or two, you have to buy that card, correct? And then you take the teeth that you need off it and attach it to whatever appliance. And then you usually, what do you do with those other 6 that you still have or 4 that you still have? So this is really important if you're printing anything, because the FDA, even though this is a class 2 device, just like sleep appliance, this, when you're printing it, it's 510K exempt. Okay, so that means you can print those 2 teeth that you need in your laboratory. The only thing you need to do is that it does require an implemented quality system. That's the FDA rule, all right? If this is the only thing you're doing, I wouldn't consider that to be a life or death decision for you, all right? And we'll address that at any time if you want on why I think that way. It does require the use of 510K cleared materials in CAD, which are readily available anywhere. And the resins with regard to printing teeth are improving basically on a weekly basis. They're getting better translucent. Anyway, so that's the only requirement for you, okay? That's good when it comes to printing, okay? As far as what, I don't say that for you, you know that, but what, from the FDA, that's about the only thing that they've come up with that impacts us on a daily basis. So let's go back to digital mouth guards. So who else has heard that if you're doing mouth guards, you have to have a 510K? Yep, okay, a couple of you, exactly, okay, yeah. So this, I got a lot of calls from clients and non-clients who just called me up and said, what do I really need to do on this? Why has this changed? And it hasn't. So what I do on a typical basis is I don't just give you my interpretation because I don't have any power here. So I call the FDA, actually, I'm sorry, I email the FDA and I get a response from them, because this is the most important thing. And some of you might not be able to see this far down, but Michael Ajadha, I communicate with him a lot, and he is an assistant director of the restorative and surgical dental devices team. So he's very integral in everything that we do. He has cleared a couple of the 510K submissions I put in. So he's involved not only in communications and guidance and direction, he also is a reviewer, besides kind of running the new dental division. So in this letter to me, he said, and this was in regards just to a digital, he said, in the process you described below, and in that letter, it was the process that we go through in digitally processing a mouth guard, it appears that the lab does not develop specifications. And that's the most important part to understand, is that you aren't designing it freely. You are really led into what you need to manufacture according to what that patient's dentition dictates and what the dentist wants you to do. He or she gives you those directions. So you don't develop the specifications for the device, but are patient matching a device per the dentist's prescription. This appears to fall under the exemption we provided as 807.65I. Remember, we talked about 807.6, we're going to hear a lot. So that means you're free and clear to do anything you want with these. Do them by hand, put them up and digitally design, thermal form them, whatever you want to do. They're completely covered under that exemption, right? So that nothing you actually have, not even a quality system at this point in time. Okay? Does that make people feel better? Yes, please.
So if a doctor sends for a mouth guard and the technician decides to either go digital or acrylic.
Analog, yeah.
Right? So that's a decision they're allowed to make.
Mm-hmm. Most certainly.
As long as it says mouth guard or whatever.
Correct. Right. So
Protected under his license.
yes, correct. Did you hear those questions? I should repeat them because you're not on microphone. So what he asked me is, if a dentist, or when a dentist enters into a work order, a prescription, or a RX, can the dental technician decide which way to process it? Is it an analog or is it digital? Handcrafted or computer driven? And it certainly is up to the technician, unless the dentist states it on his or her document when he or she says, I want this digitally done. Most of them don't care. So that's and the materials you use is up to you. So there's a lot of different materials that you can use. There's readily available in the marketplace, and whatever, it's up to you. That is covered under the exemption because you are looked at as a traditional manufacturer. The FDA recognizes you as an authority in the process. Because a lot of times the FDA also recognizes in my conversation with them is the dentists don't know what they're talking about when it comes to manufacturing. Okay, they just say, hey, just do this for me, and they trust you in that process. Okay, and I'm not telling you anything there. All right, so we covered all this. Okay, okay. So that, with regard to you, that's all we need to talk about. I mean, he did talk about that. You have to use 510K stuff and make sure that everything is cleared, and which it is. I mean, we work in an industry because of that exemption. And this is a great point. At least I think it's a great point. Because of that exemption that was provided to you, the way the FDA responded to it is they require every product that goes into a patient's head or is in a tissue contact material is 510K cleared, which means it goes through a process where the FDA evaluates it not only at the mechanical level, but also at the biological level to make sure that it's completely compatible. It's not transferring anything, any contaminants or anything that could harm the patient. And we have, as an industry, compared to other industries out there that are making hips or whatever it might be, they go through a lot of scrutiny. They go through a lot more scrutiny because they don't have a lot of the shielding that we do regarding the products that you use to manufacture in your medical device manufacturing facility. So we literally are kind of walking in a really nice path because everything we do has been cleared and we know it has great compatibility, it has great efficacy, and so we can walk lighter, all right? Not have to be so concerned about our industry and hurting a patient. So that's good moving forward that way. All right, let's talk about, okay, here we go. So with regard to mouth, there are mouth guards that require a 510K. There's 3 of them, 3 categories, okay? One of them is, this is the product code. We looked at PZY for the denture tooth. It's MQC, and it's a mouth guard prescription. The reason why that would require a 510K, this is that knowledge part I want to get into you, that understanding, is that is when the mouth guard literally makes a claim. So my mouth guard from Tim Torbenson Dental Laboratory helps people grow hair. It's amazing. You use this mouth guard, you grow hair. And usually right where you want it, okay? That's a claim. So if I make that claim, I have to prove that to the FDA through my 510K process, all right? So this prescription specifically was related to bruxing, okay? All right, next one is a mouth guard over the counter. We don't even get involved in that. So those are the mouth guards that a lot of the athletes will go to the drugstore and buy one off the shelf and take it home, throw it in hot water. You know the process, right? That one, because it's the professionals nowhere involved in that, the FDA has to have controls over it and make sure it's cleared. The next one is a mouth guard that says, when you use our mouth guard, we're going to provide you migraine and tension headache relief. I don't know how they do that, but anyway, that's what they say. So that's why we have these 3 that do require a 510K, and if you manufacture these, you have to go through processes in your laboratory. But if you do a mouth guard, you just don't say anything. What does a mouth guard do? It doesn't do anything. It just goes in the mouth and guards, right? There's no claim to it. It just does what it does. Then you are free to go without having to think about this. But now you know about it, okay? All right. The next one. Then this is also very important, and this is going to be exploding in our profession. And I'm involved with a number of companies that I am representing that are in conversations with the FDA regarding artificial intelligence and the services that they're bringing. And, oops, sorry, I'm pushing it. So once again, I was dealing with Michael, really nice guy. But this is specifically a release on information regarding artificial intelligence and machine learning and whether a software is classified as a medical device. Now, we use a lot of software in our industry. I mean, yes, ExoCAD, 3Shape, Medit, there's a lot of stuff out there that is used in creating the proposals within our industry. All right. So I asked Michael about, okay, this is good to know, because to your point on how we manufacture things, because the services that are coming forward are, as you get a scan from a dentist or you scan a model, you send it to the services that are out there, and they're going to send you a proposal back that is done in the cloud through artificial intelligence within a matter of minutes. Right now, it's on mouth guards. You can get that done. And for laboratories who are still experiencing some issues with staffing post-COVID, this is a great service. I mean, you just send it and you get a proposal back, and it's not locked. You can still make modifications to it in your software, in your CAD system. So anyway, I should move on. So I referred to Michael. I said, okay, we want to make sure that when we have this artificial intelligence services start to expanding into other devices, how are we sitting with the FDA regarding the Orthodontic Laboratory? And he says, sorry, I'm hitting the wrong button. This is considered an automated process equipment software. So it's not a software as a medical device. It is an automated process equipment software. The software should be validated, that's up to the manufacturer or the designer, the developer, as part of the manufacturing process, but is not considered a medical device. So as these services become more and more available, and believe me, they're going to be coming, a lot of them are going to be coming soon, where you're going to be able to utilize that and literally get a proposal back in minutes. And there's, once again, there is no FDA requirements on it, no quality system required, okay? So, because again, you're making the decision on how to manufacture. You're not getting the device done for you. You're not losing control of that or the proposal, but it's just a tremendous service for you that's using software. Questions? Comments? Everybody awake? Good. Thanks. Okay, sequential aligners. Here we go. Big one, all right. So this is really important. I've been involved in, we've done 3 510Ks now for sequential aligners, and they're required. So here we go. All right, so as you all know, this is a 3Shape ad, and it's basically clear aligners are easy to do with 3Shape Clear Aligner Studio. The step-by-step solution is fast and easy way for you to add clear aligners in your lab services. Timeout. All right, so they make it sound so simple and easy. And if you do that, you're operating illegally. And this is when the FDA gets serious. This is why their inspectors carry badges. They are literally federal law enforcement officers. So they will come, if you are operating without having the 510K cleared environment, they will come in and do a cease and desist. All right, and that's serious with regard to the FDA, because once they do that, they keep coming back. This is what really annoys you, and it's very disruptive that an FDA agent walks into your laboratory and you have to stop what you're doing and walk them around and answer questions. So we try to avoid that to the best of our ability. But what's important to understand is there is a product code, NXC, for the orthodontic aligner, and it requires a 510K, clear, without a doubt. All right. So I know that when the manufacturing process between a retainer and an orthodontic aligner for you is the same. It goes through the same manufacturing, the process, correct? The difference is that retainer just is like the mouth guard, doesn't do anything. It just sits there and doesn't let things do anything. The aligner, this is again, I'm speaking on behalf of the FDA's interpretation, it's an active device. All right, going back to my first slide, the confusion section of that, well, why is a palatal expander, which is an extremely active appliance, not require any regulatory? Yeah, but then the aligner, which is probably less aggressive, but it requires a 510K. All right. The difference between those two with regard to the FDA is the FDA doesn't know everything, and then they do things in big chunks when they did in 1970 with the exemption, and that palatal expander fell under it. Okay, because everything was done by hand. And the FDA had no way to regulate all this handcrafted processes that you go through. Few of you back then, remember this was established in the 70s, had a manual you were going by. right? Yeah, you went through an education, became an orthodontic technician, you knew what you were doing, and you followed what you had learned. But the FDA had no way of having any oversight and then coming in to audit what you're doing. And they just said, forget it. It's too complex for the FDA. So the FDA said, give them an exemption. And that was industry-wide for not only orthodontic, but the dental. The other thing that impacted them is at that time in our history, in 1970, there were over 16,000 dental laboratories in both categories around the United States. And the FDA looked at that with their little staff, and they said, there's no way that we can manage that many organizations. And when they looked at a dental laboratory then, it was like 3 to 5 guys working in a dark room, and they just said, there's no way we can manage this. So that's when the exemption came about. That covered the palatal expander, okay? Because that's, I know it gets confusing when you think about the activity of those from a logical point of view, but then again, when we talk about logic and a federal government agency, logic doesn't exist, okay? Because they just do things like, what? Okay, so that's when the new dental division, which is completely changed from the dental branch, and now they have the understanding, a better understanding specifically because of the processes we go through digitally. There is definitely a dictated process that it comes from the manufacturing, that comes from the software that you're using, the thermoforming. Now there is a process. Now that there's a process in place and the FDA has a better understanding, even though there's fewer labs now in the United States, there are about 6,000, they now have the opportunity to come into your lab and see what you're doing and how you're doing it, and have it documented that you're doing it. And you're a dental laboratory that does orthodontic aligners, you've got that quality system in place, and you document every step of the way. That's what the FDA requires. The good thing for you is that you do all those things. Everything that the FDA requires, almost, I shouldn't say everything, about 90% of what the FDA requires in a quality system, you're already doing it. Because you care about what you're delivering out the door, you want to make sure it's appropriate. So I'm going to move on here. Oh, so you also have an opportunity to do be a contract manufacturer and work with someone who is a 510K holder, or be a relabeler, repackager. All right. So again, FDA terms are a little bit different than what we use. So an R&R, repackager, relabeler, is what we would call a private label. Okay. Someone manufactures it for you and puts your laboratory name on it. So it's your appliance when you present it to your clients, okay? A contract manufacturer's agreement, I don't know many 510K holders for aligners who are going through the contract manufacturer agreement. Under a contract manufacturer agreement, that creates a relationship between a 510K holder of an orthodontic aligner, and they give you permission to manufacture under their 510K. That's like the sleep appliance. If you go to Airways Technologies or anybody else out there who has a 510K for sleep appliances, and they allow you to manufacture it in your laboratory under their name, and it has to be branded under their name, that would be a contract manufacturer, because you're actually manufacturing the device. All right, so that's one. And that's existed in the dental industry for a long time with sleep appliances. Okay. So that is an option that you have if you can find a contract or a 510K holder who's willing to have that relationship with you. There are more of them that are doing R&R, the private labeling. So you don't do any manufacturing. So that would be where you receive the RX from a dentist for an orthodontic aligner. You would send that to the 510K holder. They will manufacture it. There's options here. They will manufacture it. They'll put it in the shipping container that has your dental laboratory's name on it, and they'll put your labeling on it, and then they'll send it back to you. So you're literally just a pass-through. You get an RX, you pass it through the 510K holder. They manufacture it. They put your labeling on it. They send it back to you, and then you send it to the client. All right, so it's kind of just an easy way to get into the business. But of course, the aligners, there's a fee associated with it. They got the 510K, which is expensive. And of course, they're manufacturing it for you. Your options here are that you can either just pass it through when you get the RX, or if you get the scan, or you can do the designing in-house. And the reason why you'd want to do that is to start learning the process and the design process, so that if your market share grows dramatically and you decide, I'm going to take on a 510K, they cost you about $40,000 to get a 510K. And you have to have a quality system. It's included in that. And obviously you have to register with the FDA as a medical device manufacturer, okay? So that gives you the opportunity then to grow your client base, to have a clear understanding that there's an ROI in this that makes sense for you. We should bring this in-house, okay? So that's the three different ways of being involved with orthodontic aligners: is being a 510K holder, create that contract manufacturer relationship with a 510K holder, or a private label arrangement. All right. Questions?
Can you have the doctor purchase the software that's under their license?
No. So that's one of the other things that we will talk about later, is called you're the manufacturer of the finished device. And there are those that are covered under the exemption, and then there's others that are not. And that particular one, because of the 510K relationship. So if the dentist buys the software and the license, all that comes with it, and you are the manufacturer of the finished device. So if it's a 4-tray case and you do all the trays, you're the manufacturer of it, you're responsible. So everything comes on you. Okay. That's the way the FDA views it. The manufacturer of the finished device. Yeah.
So, but if you were an employee of the doctor at that point, then you'd be manufacturing it under his name or under their name.
Okay, and we're going to get into this pretty soon, but I'm going to answer your question directly. So if you're manufacturing for that dentist as his employee, and those aligner cases are only for his patients under his practice, then the answer at the present time is yes. He can do it under his license. If he does it for the dentist next door as well, then you become a commercial dental laboratory. And then you completely walk, because that exemption I showed you, there's actually one for the dentist and there's one for physicians. And it's this 807.65I, that one is 807.38, somewhere in that same form. Okay, that covers dentists and physicians. So yes, but the FDA is starting to question that. We're going to get into it. Did I finish this? No. Am I upside down? Maybe. Okay. Okay, so it requires that 510K. I think we killed that one already. And then it also requires that you have a quality system and that you register with the FDA. Okay. So any questions on that? Is that clear? Are we good?
One quick thing, just to
Yes.
clarify.
Tyler, yeah.
Isn't it true though that as long as you don't advertise it and the doctor asks for just a couple of movements, you kind of have a gray area there where
No.
they're not asking for an aligner, but you do it anyways?
This is, that's an interesting question. I get it a lot. And there's a lot of things that you can get away with, and there's conversations I have with my clients. It's like, we got to be careful. First off, don't document that you've done it, because that's what they come in and look at, is your documents. So if you have a one dentist who sends you a case every 8 months, doesn't justify getting a 510K, obviously. However, if you have relationships with laboratories who are 510Ks, you should send it out to them to be legal. It is that particular process you're describing is illegal, right? Because once again, you are the manufacturer of the finished device. Even if it's just a few times a year, it matters. All right. So the likelihood of the FDA, it's like, have you ever been driving in a car and it was 45-mile-an-hour speed limit and you were going 70 and you got away with it? That happens. You get away with it. But there's also times when you get caught. It's going to happen. Okay. Okay, should we move on? I'm not used to this device. I've got my own, but I picked up this one. All right. This is where I wanted to get to. I think we're going to spend some time on this one. As to the question, and I'm sorry, I don't know your name. Jason. Okay, so as to your question and the scenario that you are describing has become more important to the FDA. And so, and the reason why this happens is what I refer to as like turds have floated up to the surface and become exposed. Something has happened within our marketplace, not just ours, and when I say that's medical health. And the FDA has come up, and that whole long description I went through, the process that the FDA goes through, is now coming to point. All right. So this is a discussion paper, which is the first process where the FDA starts calling in information from us, and it's specifically to 3D printing devices at the point of care. All right. This is an opportunity for you, and depending upon how you feel about this, which is orthodontist manufacturing devices in their practice, the FDA wants to know more about it. And it's going to be interesting to go through this document. I'm not going to go through the whole thing because it's long. But if you want it, actually, I'm going to make it available to ORG so they can put it on their site so you can download it. Okay. So this is right out of the document. So 3D printing at the point of care can take different forms depending upon the number of factors, including the capabilities of the healthcare facility regarding the 3D printing activities and the complex of the product and its printing. Most point of care 3D printing situations will have unique considerations, and the healthcare facilities, capabilities, expertise, and experience factor into determining which devices are appropriately 3D printed at the point of care. The reason this came up because there were patients that were negatively impacted when they received the device. Either it was implanted into their body or it was patient contact, tissue contact device. And they had negative effects to that. So the FDA is stepping back going, we need to learn more. The way they learn more is they open up a discussion paper, okay? They're questioning a number of different things as we go forward. The FDA recognizes that healthcare facilities may not have the same level of expertise or familiarities with FDA's regulatory framework for a medical device as traditional manufacturers. You're traditional manufacturers. You obviously, you know about the FDA, you know what you have to do because it's within your industry standards. And you follow the instructions you get on the products that are 510K cleared that you receive, then you work on them. You follow the instructions. Doing that, you're following the FDA requirements, quality system requirements, okay? So that's why the FDA looks at you. You are medical device manufacturers. We don't talk about it that way. And in our industry, sometimes our clients, those orthodontists, say, well, you're just technicians. No, you are medical device manufacturers in the view of everybody else, okay? So where was I? Okay, and a healthcare facility should, however, ensure that any medical device 3D printed at the point of care will be high quality, perform as intended, and will not expose patients to unreasonable risk. That's happened, okay? So they want your opinion. Are you interested in giving the FDA your opinion on this being done? No, you don't? You want me to stop on this? That is a great point. Okay, so what Jason said is, do we want to be on the radar with the FDA as someone providing them information? How this is collected is not collected by any of the divisions that are related to the dental division. It's or in the orthopedic division. Okay, there's a bunch of different divisions that are specific to, we'll call them specialties, all right? Like, however, this form, the information that you provide to them goes to an agency that collects it, turns it into a data sheet, and when it's delivered to the panel to begin this draft version, has no idea where the information came from. It's completely washed out. It's only a series of numbers. right? So they're not going to say, hey, Jason said this about orthodontists. We should tell the dental division. No, not going to happen. Okay. So there's no radar screen that you can be put on. Fair enough. I'm running dry. Okay. Where was I? Okay. So the point is, there's more, is that the FDA has become aware of this, so they want your information. So let's look at some of the other points within the this document. And I'm taking out the things that just caught my eye. And there's actually, there was like 30 slides on this section, and I pulled a lot of them out because I was killing it. But anyway, so assuring device 3D printed at the point of care are safe and effective. The FDA regulation is designed to provide a reasonable assurance that devices are safe and effective. This assurance applies regardless of where or how a product is manufactured. Where or how? So that means, is it done in a hospital? Is it done in a DSO? Like a DSOs will have their own laboratory, central laboratory, or how it's manufactured. As long as it's 3D printed, that's where they're getting a point. I also want to say that this paper involves not just the resin 3D printing that we deal with, but and the next thing that's going to be coming in our industry is a metal printing chrome. And they're starting to play with titanium, but I say that because when they start printing titanium, they almost have to evacuate the building because it burns like magnesium. It's like, oh, it was a really nice print, but the building burned down. Okay, so, I'm sorry. Still getting used to this device. So assuring appropriate device is printed at the point of care. So appropriate device control, I'm sorry, that's an important word. Assuring appropriate control of the device that's 3D printed. Clarifying the reasonable entity. Okay, the responsible of the entity, I'm sorry. So the responsible of the entity is really important. So who, when you have it manufactured within a hospital, who's responsible for its quality? Where does it fall on? The doctor, the nurse, the technician in the hospital? Where does that responsibility fall? The FDA doesn't really quite know. And the point of care training and capabilities, that's a big concern because I'm working on the conventional dental side when a laboratory all of a sudden appears in a dentist's office, but he doesn't bring in any technician. He buys a mill, he'll buy the sintering oven, he'll buy the little stain kit, and then he'll train his staff on how to run all that stuff. And you'll wonder why none of his crowns fit. Okay? And then they send that stuff to one of my clients to fix it for him. Right? It drives you crazy. So they're really going into areas, they're educated to be dentists or orthodontists. They're not educated to be manufacturers of devices, period. Okay, and the FDA's figured that out. Question number one, you want me to keep going on this? Okay, no. So what challenges would a manufacturer of a medical device production system, referred to now as MDPS, face in being generally responsible for FDA regulatory requirements for 3D printed devices by the healthcare facility at the point of care using the medical device production system? Does the need for post-processing make a difference in these challenges, and if so, how? What? No, I know. That's okay. Yeah, exactly. But what they're looking at here is what they realize is they're starting to understand 3D printing is really important, and not only with the resin that we deal with, but with the metal, because the metal ends up being implanted in the body in most cases. The resin at the point, that's pointed tissue contact materials. But if it's not properly post-production processed, it can carry and has carried contaminants into the body. And that's where the turds floated to the surface. It's like, oh, we've seen another one. I won't pick on the FDA. So at least they're thinking about this, but they don't understand it yet, so they need input from you. Here's my concern. When they put this paper out, who gets it? Who responds to a paper like this? Well, I would, okay. What about the manufacturers of the printers who want to make sure that they're still selling that device to hospitals or dental clinics, right? Or the salesperson who is going to get a copy of this, the salesperson of that device is going to respond to it, right? The administrator of the hospital is going to get the copy of this and they're going to respond to it. And they're extremely biased and slanted to one side. So is the FDA going to get appropriate information if they don't get it from us? You face it, you experience it, you know what's going on. Let's go to the next question. 2, am I in your way with my big head? All right, point of care 3D printing facilities in the healthcare facility may need to conduct certain activities after using the medical device production system. They may. Come on. All right, so that could be heat treatments, that's metal, drilling, whatever. Because the quality system regulations would require the manufacturer's verification and validation of the medical device production system. Say what? Require the manufacturer's verification. Who's the manufacturer? Remember? Who's the manufacturer of the finished device? That's whoever makes it, whoever prints it. So this would be the dentist, this could be an orthodontist, this could be a hospital staff. They're responsible for verification and validation of that device. Do they have that capability? Simple question. Do they have that capability? Okay. I see head shaking. All right. So where was I? Okay. Verification of the aspect may be satisfied. Okay. Oh, I love this. So verification and validation of the medical device production system, some aspects of the quality system regulation may be satisfied. Maybe. Is that satisfactory? No. Do they know what they're doing? That's your answer. Okay. That's for you to answer. Where am I? Okay. Are there aspects of the quality system regulation that may not be covered by the medical device production system? Manufacturers' verification and validation such that more is needed to sufficiently address post-production activities? Question. The FDA is not quite sure what's going on. They need to find out, so they're concerned, correct? Let's go to the last 2. All right. Are there any post-processing activities that should not be undertaken by a healthcare facility? What's your answer to that? Hell no. Okay. If so, why? Why should they be doing that? Should 3D printed devices that require certain levels of post-processing only be printed by a traditional manufacturer? That's you. That's a good question. The FDA is trying to figure it out. What guidelines are they going to create to take control of this environment? That these devices are being manufactured in places in facilities where they shouldn't be. That's what they want to find out. Okay. How could the use of the medical device production system to 3D print devices at the point of care fit into the FDA's existing adverse event reporting system under 21 Code of Federal Regulation Part 803 for user facilities and manufacturers considering that user facilities may be conducting activities that could be considered manufacturing? So what's I love getting stuff from the FDA like that. You read it, go, I think I need to read that again. Like, what are they saying? But this is where they're really concerned about getting into the situation, because there is one thing that we don't get into, and I talked about it before, is that we don't hurt people, but there is a process, and I put it into everybody's 510K, not 510K, their quality system when I write one for them. It's called an MDR, Medical Device Report. And it is a process where they are reporting to the FDA adverse event reporting system. That's the MDR. And if you go to that and you read through, and it would be, if you want to read what's going on with orthodontic aligners, like with, who's the one that's in the malls? Sharp, pardon? Smile Direct. You should see the complaints on their stuff. Oh my gosh. Regardless, But that's a system where there is a system where those adverse events that are experienced by patients usually come directly from the patient or their attorney into the FDA adverse event reporting system. And pages long. It's unbelievable.
How are they so necessary? I mean, how are they not?
That's a great question. Yeah, and I can't answer that because that's up to the FDA. Eventually, they will take action against it when it's to a degree that they can no longer handle. And believe me, the FDA has been there asking them questions. Let me look at your quality system. Let me look at what you're doing, how you're operating your procedures. Why are we seeing so many complaints in that system? Yeah, but I can't answer that. I can't answer what the FDA does, which is probably better for me. So this is the 4 questions that they pose. Okay, that's it. They in the next page they do ask. They give you how to respond, the website, and they also add a statement that says, "But we are wide open to any comment that you may have outside of those 4 questions. Any experiences that you have, any input that you have regarding these healthcare facilities involved in manufacturing these devices." Okay. So I'm going to get this into through Lance into the ORG site, and you can just go there and you can download it. And again, to your point, it's complete anonymity. I mean, whoever sends this thing in, even if you do it under your dental laboratory name, that all gets washed out. It just ends up being a tabulation of the numbers and the comments and real, statements. But there's no quotation marks with you around your name or your lab number. Okay. All right. How am I doing on time? Okay. Any questions? I was anticipating a lot of questions on this. Yes, please.
So if you wanted to partner with the doctor to do like clear aligner system, could you start an LLP or like a limited liability partnership with the doctor, or bring on like as a joint venture add-on doctors? Like as a contract, could you do a joint venture as a handshake deal over a short period of time or a long period of time? Or you could do a joint venture contracted or
I understand. Okay. So my answer to most situations that are presented like that is it depends. That's not me, trying to ignore it, but it depends on a number of different factors. I'm going to go back to the way I responded to Jason's question, is that it's going to depend on how those appliances are delivered. If you have a relationship are you a commercial dental laboratory first off? All right, then you can't do that. You have to have a 510K because you're a commercial laboratory. If a dentist manufactures that in his or her practice, orthodontic aligners, and again, they only sell or deliver those to their patients under their practice, they are at the present time, until this opened up, they are exempt from the FDA requirements. As soon as it becomes a commercial entity, whether there's a dentist involved as a partner, it's illegal. That you have to have that 510K. Okay. Yes, Brandon.
So what's involved to become an R&R?
So if you want to become a private labeler or under the R&R, or relabeler, repackager, is that you have to have a contractual agreement with the 510K holder, and it's very similar to the contract manufacturing agreement, with the separation of the manufacturing still being in and done by the 510K holder. The R&R or private labeler, say if it's my lab, I need to have a quality management system because I need to demonstrate that I'm following that device as it goes into my client's patients, because you're removed from that process. So I need to have a quality system and also register with the FDA. So it's an investment that's involved in getting into that private label relationship with the 510K holder. their responsibility as a private labeler, and again, delivering that to their clients to be delivered to their patients, there's no tracing, there's no lot numbers, there's no trackability on it, except for what comes with the UDI number or should. They need to document that they inspect the case as it comes in to make sure, to the best of their ability, that the information or the scan or the impression is accurate. It's not distorted. There's no, if it's a scan, it doesn't look like it's corrupt, and then they send it to you. And that's a quick visual contact. You do your thing on your side, and then when it comes back, they need to inspect it again to make sure that it is manufactured properly to the prescription. So that's the process that they're responsible for, and that's another visual check. They can't open up the pouches because they're clean. And then if there's ever a complaint, they need to document those complaints. So it's a portion of the quality system that they have to follow. But they're selling under their laboratory's name, my name, Tim Torbenson Laboratory Aligners, and I get to do that.
And the complaints would be in corrective action, preventative action, or the MDR?
No, okay, like for example, your quality system, we've implemented MDR. You're never going to use it. You never get to the level where you've damaged the patient, where you extract a tooth, something like with an aligner. It doesn't happen. Well, okay. I'm sorry. Are you hearing his questions? All right. Let me go back. So he asked me, what do you have to do to become an R&R, private labeler? Okay, that was and then I went through the response. I went the contractual aspect, and then for the R&R, the quality system responsibilities and registration. Okay, and then your next question was.
So if there is complaints moving up through that,
right,
where would that go, like in the process from the R&R to the actual manufacturing?
Okay, great question. So how is that information? So within our system, the quality system, there are several categories or levels of complaints, and as they escalate up this level, at one point they need to be reported back to whoever the 510K holder is, the manufacturer. So the levels are, it's a standard complaint, and so the responsibility within the 510K, within the quality system, is that you have to determine what went wrong and what initiated a complaint from the client. All right, that doesn't go to the 510K holder yet. The next level is what's called a corrective and preventive action within the quality system. On? Mike, oh my God. I feel caged.
Oh, there you go.
Wow.
I'm guessing the battery's starting to die.
Let me see.
Where's the-
May have something to do with it.
Where was I? Oh, so as we escalate, as the complaint is escalating into a CAPA, the way that happens is, for example, through your evaluation process of the complaints, you recognize that there is a trending situation that's occurring. For example, within the last 8 weeks, you've received 8 complaints on a specific topic or a point in some manufacturing processes. That's when it escalates up to a CAPA, corrective and preventive action. That means that would go to the 510K holder, because now it's identified as an internal issue in the manufacturing process, and you need to address that, and you need to document that you're addressing it. So those of you who are clients of mine, you know that's in your system. But it's great point is when, and we put this in the R&R contract, is that when a complaint within the private label or the R&R facility escalates to a CAPA, then that information needs to be passed off to the 510K holder, so that you always have control of exactly what's happening within, not only within your operation, but how it's being handled at the R&R, at the private label. Okay, did I answer that correctly?
Yeah.
Okay. All right. I can't move?
No, it's the backup mic. When it's on, that turns off. So for people who
Oh.
have questions, I'm gonna hand them the mic.
Oh, thank you so much. Okay, I can move. Okay. Any other questions? Any other comments on this? Are you interested in getting more involved and you want this paper? People are like, I don't know. Yes, but you understand. Yeah, well, yeah. The FDA this is an opportunity for you to be able to tell what you think about the orthodontic practice manufacturing appliances. You know, I have clients, they call me up and they're upset about this. And actually, I'll say they mention it when we're in conversation about other issues. It's like, I got another appliance in from an orthodontist or even a dentist, and they want me to repair it, and we didn't make it. And we can look at it and see that their amateur level created this device. So why are they sending the repair to me? All right. So it's like, I would stop to have orthodontists doing this in their lab. So this is just an opportunity for you to do that. On the traditional dental laboratory side, there's a lot of interest in it because there's dentists in their offices that are buying mills. They're getting into a sophisticated level of restoration manufacturing. So anyway, move on.
I have a question.
Oh, yeah,
It
please.
probably goes back. So if you're making a Holly that has a spring in it,
Yeah.
because so a spring aligner Holly, because those were way back when, did those fall under the thing kind of the same as like an RPD?
Yes.
I mean, well, nothing. You guys can hear that too. Okay. Yeah, I've heard my voice carries, unfortunately. So yeah, I didn't know where that fall in because it's doing the exact same thing as a liner.
Yeah, exactly. And that falls because the Holly's been around forever, and it falls under the 1970 exemption. So it's okay. Correct. Right. So at the present time, the only thing that we have to be concerned about with regard to the FDA is going to be aligners, right? Because that has been moved out of the exemption, right? Sleep appliances, they have been moved out from underneath the exemption. They require activities by the FDA and by the manufacturers of those, all right? But the 2 years ago, when I was talking with the FDA regarding orthodontic appliances, the FDA had not landed on any point. They wouldn't commit to me on anything regarding the appliances that we historically have been used in orthodontics. And going all the way back to the palatal expander, the FDA still is not, so they finally did land on that and they're not going to do anything. So that's really good news. So for example, I would get questions from laboratories that's like, I have a 3D printer, I have a CAD system, and I am printing almost all my models now, right? And according to some of the consultants, that if you have a CAD system and you have a 3D printer in your lab, you need to register with the FDA. No, completely false. You don't need to do anything. The FDA recognizes that particular process as a foundational unclassified process. As a matter of fact, the mouth guard is an unclassified device. So we don't even start talking about the FDA and classifications until we get class 1 and class 2. Okay. So everything that you've been doing, nothing changes. No FDA requirements. Should you have a quality system? I always say yes. I'm going to address that now if you want, if I have time. Maybe not. Okay, because that's going to be at least 40, 25, 30 minutes. Anyway. So I think I'm done. So I think I answered your question. So with the FDA making, with regard to what their decisions have been made regarding orthodontic appliances, they're not going to change anything within the exemption, which is like, yes.
So do you think we're going to have changes with expansion? And the reasons that I'm asking, because I know that 3Shape is getting out of appliance designers software. They're getting away. They're not going to offer that. software anymore. You aware?
Yes and no.
So they're stepping away from that business, 3Shape. So how will that impact us? The expander is moving teeth according to doctor's preferences. But really nobody knows which directions and which side is expanding. So will expanders become classified under 510? Why not?
They go back to the exemption. Just came in, so you missed a portion of our conversation on that. Is that the exemption that was brought forward for dental laboratories and orthodontic laboratories back in 1970, it covered all the appliances that have been manufactured since then. So palatal expanders do fall within that exemption because there's a history that exists with that particular appliance. One is that there have been very few complaints through the device adverse event system, just because they work and they don't really hurt patients and you know what you're doing. The other side goes back to a lot of the situations within the industry of the numbers, the difficulty of creating oversight on it. So the FDA has decided not to make any changes within the appliances that are falling under that historic exemption 807.65I. So you're good. It changes, I'm not going to say it changes. It could change when you become the final device manufacturer by printing the entire device. So at the present time, there is no requirement from the FDA regarding 3D printing of that device, as you are recognized by the FDA a traditional manufacturer of such devices. So they look at you as a reputable firm. Okay, so that they have decided not to bring anything forward on that at the present time. Does the FDA change at times? Yes. So when I get a discussion paper from them, and this is the process they'll go through it, I know you missed a lot of this, but the discussion paper is what they will come with first when changing product classifications for existing devices. Right. So when has that happened? All right, and it hasn't happened in your industry, but it's happened in the traditional dental laboratory restorative side with surgical guides. A surgical guide is under MDP product classification, which is an accessory for dental implants. Okay, so that includes drills and includes screwdrivers, all this, this stuff. Right. The FDA put together a discussion paper, put it out, and they went really fast on this one. It was only like a year and a half. And they changed the requirements for manufacturing surgical guides within the dental laboratory. There are some companies that have gone ahead and gotten a 510K for the process, and that's your choice. I mean, let's say I'm gonna do a Holly, and the ones that have springs on, I'm gonna get a 510K for that device. That's completely up to you to do that. You can get a 510K for any device. That gives you the opportunity then to use it through the validation and clarification process that you got through that 510K. All right, so then you can make claims in your laboratory. It's like, hey, Jason's Holly with springs works better than anybody else's. I wouldn't make that claim, but anyway. So if you want to do that for the SLM printing of that device, you certainly can get a 510K for it. But at the present time, I was on surgical guides, I'm sorry. It hasn't happened. So in the surgical guide thing, after the discussion paper came out, they sent out a drafted paper, then they sent out their final guidance on that. And at the present time, if you are manufacturing the finished device, and you guys have heard that name or heard that term many times, if they manufacture the finished device in their laboratory, they have to have a quality system and register. So that is what has been brought forward. And for your laboratory, we've already installed a quality system in your laboratory. So you're covered in that regard. You're not registered, but you're compliant, but you're not a recognized medical device manufacturer through FDA registration. All right, that's the next step, and we want to take that.
So can we fall under that if it's not a finished device, like if the office just has to polish it or something like that, like ghost guns? Can you?
Yeah, then no.
Okay.
Trying to get out Dental laboratories would, on the implant side, the FDA requirement was that when you have a tie base and you put a coping on top of it, zirconia, to create a final restoration, the dental laboratory was required to have a quality system and register with the lab, okay? So what the laboratories did, say, we have a loophole. What we're gonna do is we're going to send the two components separate, so it's not a finished device, and we'll have the dentist cement them together in the patient's head, right? And they thought that was their loophole. And the FDA said, oh, nice try, no. Yeah, sorry, no. So in that same regard, if you send it to the dentist, say, hey, polish it because it's not a finished device. Yeah, no, can't do that. However, where it is legal, for example, so I have a number of clients who are 3D printers of metal, and they send out what the FDA considers subcomponents, which is an unfinished device. So that's a partial framework, okay, or any kind of metal framework that you then build to. It's a component of the final device. They aren't exempt 100% because there's the metal that they're using in their printing process needs to hit ASTM standards and be presented. There's no reporting to the FDA. There's no registration required for them, but they have to have a quality system to demonstrate that they are following the appropriate quality system guidance that they're questioning now for healthcare facilities. Okay. No, sure, no.
Do you think time will come they will require us to print some kind of ID on a metal expanders? Like an implant, like a new, there is new guidelines coming out, right? For like medical trays, they have to be edged with a certain, scan number. Well, yes, but maybe laser etching the expanders to put a numbers in. Do you think? Yes.
That has already come forward. So the UDI requirements are that for the device, the UDI, unique device identifier number, needs to be, that needs to be on the device if it can be done. But when we look at, for example, a dental implant, which is 8 millimeters by 4 millimeters diameter, there's no place to put that. Plus, why put it on something that's going to be buried in the body anyway? So the UDI can be accompanied on a label or on your invoice or whatever documentation you send with it. It can be a QR code, but it definitely has to be a numeric code as well. Okay, that's UDI with what you're speaking to. So that guidance has already been presented and done, and that particular device, and this is going to get bizarre. This is what you opened up Pandora's box. So on that one, it just needs to be accompanying. All right, so UDI is insanity. And the FDA really regrets coming up with this guidance. And to your point, what it is that every single appliance or device that you manufacture has to have a UDI number on it. Okay, a UDI number is about this long. It's over 25 characters. And it started out to only be on class 3 devices, and then it came down to class 2 devices, and now it's coming down to class 1 devices. And when I say the FDA regretted this, it's because they had no idea what management responsibilities they have, because the UDI number, think about this, every appliance you manufacture needs to be reported to the FDA. The FDA then has to just think about how much data they get every day, and they're overwhelmed. Their system crashes all the time, and they say, "Oh, we just regret this." But now, once they commit to it, they've committed to it. So they're investing dramatically into expanding their storage capability and staff, which is good, because if they're spending money there, they're not putting inspectors on the street. Right? So. Anyway, so this is what you're speaking to, is this UDI process. And I haven't had a lot of my clients move to that point because the FDA has no enforcement capability at this particular time. Are we operating illegally? No, we're just giving the FDA a break, because first off, they can't handle all that information. Okay, did I answer your question? And then I expanded, I went someplace else, I'm sorry.
Yes and no. So should we expect it, that it's going to be one of our requirements?
Yes, it exists already. We're already behind time. This was supposed to be their original final date for the Class 1 device was 2020. So we're in 2022, and it hasn't really taken hold yet. I have, in the last 4 years, I've been in 13 audits with my clients where the FDA was sitting either across the table from me or I was zooming in on a remote. And only twice did the UDI come up. And we got a 483 on it. We got a citation of deficiency on that because we didn't have our UDI. And he said, please, and he said, just please get it, would you? And I said, yeah, but your organization, the FDA, your agency can't even handle it. He goes, I know, but you have to do it. You've been caught, okay? That was it. That was the end of the conversation. So we did. So it's coming, yes, but I'm in no hurry to act on it as your liaison to the FDA. But yeah.
But what's going to happen to people that still going to manufacture traditional bands, where they have no capability to treat metal, or they're going to have to go to laser engraving industry and start engraving some of them?
No engraving on the device. That is not a mandatory thing to do. It's an elective. It's your elective to determine where you put the UDI. It does not need to be on the device. It clearly does not need. The original guidance that came out regarding UDI did say you have to laser etch or imprint on the device itself the UDI number. Again, it's this long. And it's like, well, how many devices do you have that are this big? Or a QR code. And so when they received a tremendous amount of pushback from the industry, they modified that to make it your elective as to where you put the UDI. Okay, so for example, this is some of the nightmares that they opened up for themselves. When you go into a hospital and they have these large surgical trays that someone will roll into an OR, and they open up this and there's full of instruments and they're all separate and individuals, and they'll start using them and they'll drop one and then they'll break it. So that means they have to replace that UDI into that kit. So now every component it might be 100 instruments inside this surgical kit. Everyone has to have its own UDI. So now the kit has been modified, so they got to change everything within the kit. It's a nightmare of bureaucracy. And that's why I'm not bringing this on to us or my clients yet, because it's insanity. And again, the FDA is just not able to handle it. So they've opened up this Pandora box. It's going to do nothing but create cost for us. So are you in a hurry to do that?
No, but
Good.
Seeing what's going on in the biggest manufacturer, the doctor's office. Yeah. So I don't know about UDI, but they will. FDA you will have to get compliant with FDA. They will not. So they let's be clear, they taking business away from us, or we have to partner with doctors to be able to manufacture something like that, or we'll have to become like if we'll have to get 510 compliance on our expanders.
Yeah, so that means they have to change the entire category for that device. Surgical guides. Surgical guides is they increased it up to you have to have a quality system and register. That's it. To go to a 510K on a device that has been on the market literally for years, well, a long time, with no history behind it, the FDA has no grounds to change that. That would be an easy fight for us to say, what are you doing? And they don't want to do that. They don't want to create more work for themselves. So if there's new technology that comes forward for a new appliance, that's a different story. Yeah. But I understand what you're saying, because 3D printing of a palatal expansion appliance is technology change in the manufacturing. It's probably it could be a material change in the device itself. Yeah, no one's and the FDA is not going to. We'll have to watch. There's another we have to continue to watch, and there was an article that was presented, I'm sorry, guidance that was presented by the FDA in 2016 on 3D printing. And they have added to that, but it's all been in other industries, hasn't been in ours. And again, I'm going to go back to the fact that as an industry, as a profession, we don't hurt people, all right? And we don't show up in the adverse event database, except if it's those sharpshooters or whoever that was, those aligners in the malls. So that's the only thing that the FDA has looked at. You can look at the dental implant companies. They have adverse events, but it wasn't caused by the device. It was caused by the alleged surgeon. Okay, so that's what we've seen. All right. Any other questions or comments? Because I'm going to wrap up, because if I get into the next section, I'll be here another half hour, which is quality system. Okay. You guys are probably done with regulatory. Okay, and nothing else? All right. Well, then I want to thank you for your time. Is that in my next slide? No. Oh, I was on this the whole time. All right. I want to thank you for your time and the invitation to come. If you have any questions, I need to get to a slide because this is all the information if you want this deck. So bear with me because I got to go through this one at a time. What if I have? I can't blank it out. See, you missed all the stuff on why you should have a quality system. There you go. So if you want this deck, take a shot. That's my email address. That's my cell phone number. And if you just say, hey, Tim, can you send me your deck? I'll email it to you. You'll get the whole thing as a PowerPoint. I'm not going to PDF it, just in case you want to use it for training or whatever. Okay? So again, thank you so much for your time, for the invitation, and I look forward to working with you and continue to work with the organization. Thank you.